Let's see now if we are live. This is, of course, a first of its time. No, I'm not seeing a live on my page as yet. So even though Satish is okay, I'm live now. I'm live now. Let me see what is the public's, what is their take on it. I see two people join us. So that means the word is getting out. I want to explain to you all the difference between tonight's live and normal. I'm gonna have to press play on this so I could keep real time and see you all with me and see your comments. I need you to hear this. PEP Media is working with us on, if you look at the top and you look at the name of this show, it's called PEP Stream. Minutes to Midnight is the name of this episode. But we're gonna be doing a stream from on location. Now I'm counting the delay and it's looking like at least 30 seconds delay between when I say or do something. So that's going to throw me off a little bit because I'm accustomed to reading your comments on the screen. Anyway, so this is PEP Media's response to us not being able to do our plain talk and our morning shows. I am looking at the camera, I'm looking at the screen. So if you see me, until I get accustomed to the protocols, I'm apologizing now. Tonight is our first rough test of the system, meaning we've been testing it, but now we're going live. And this is an actual show, but any mistakes and errors as we try this out for the first time, please bear with us. I'm being joined tonight on this episode, Minutes to Midnight, by Chairman of the Progressive Empowerment Party, Felicia Holder. Good evening, Felicia. And I'm also joined by Deputy Political Leader, one of our two Deputy Political Leaders, Anthony Defoe. Good night, Anthony.
Good night, Philip. Good night, Philip.
Felicia, you hearing us?
Yes, I'm hearing you. Good evening, everybody.
Right. So to those of you watching the video and Master Control, I don't mind leaving this split screen up for now. Let this be the run while the conversation goes on here now so that we could get ourselves in a gear. Everybody watching this video, please share it. It is PEP Media again. You will see the others rush to keep up and try to copy what we're doing tonight. Remember, you saw it here first. And everyone, please, if you could, share this with all your contacts. Share it in all groups. I am going to share it to the WhatsApp followers who like a guidance that we're on. So just getting that information. If you could click on the bottom of the video, you will on the share button, and one of the things you will get is copy link. And if you could copy that link and go to your WhatsApp, if you don't have all your people organized in a broadcast list as yet, my question to you is, what are you waiting on? To those who are going to see this after on the YouTube, Raphael Banfield, a part of the PEP Media team, he works with Satish Ramsaran, the head of PEP Media, who is responsible, again, great job Satish, who is responsible for taking us into the 22nd century ahead of all other existing media in Trinidad and Tobago. And this is great work. And this test tonight will allow us to bring other people on board. But let's get down to the conversation. We are at Minutes to Midnight globally. Some would have us believe, Felicia Tony, during the height of the Cold War, something was set up called the atomic clock, the doomsday clock. And every time things were getting dangerously close in the world between the two superpowers, the United States and Russia and the Soviet Union, there would be the scientists and the people who were responsible for the atomic clock, the doomsday clock. They were some of the scientists who were involved in creating the actual atom bomb. So the doomsday clock right now, because it's only for atomic war, nuclear war, it wouldn't reflect COVID-19. But I would like to go on record and say, we are either, and I'm going to make a case in this video, so the two of y'all, be prepared to defend any position you take. But I'm going to make a case and I'm going to provide evidence that a lot of what is going on with COVID-19 coronavirus is creating a hoax. I am not saying that it is not dangerous. I am not saying that people have not died. I am saying that we are stacking the odds. But I want to bring you all into the conversation, and you can open with any opening you want, and then we will jump back into that. I'm going to hand over to you, Felicia. Any you want to open with, let's feel free.
Well, good evening, Philip, Anthony, and to all of your viewers. Uh, exactly what you said with that. Is this a hoax thing? I mean, I'm sitting at home today, going through my new ritual of just trying to adjust to what is, the new normal. And the atmosphere itself is tense. I mean, there's a obvious silence, in the absence of vehicles driving and people commuting to work and stuff. And apart from the silence, the atmosphere itself, for me, it feels a little bit tense. And I mean, today I'm washing my hand and I'm wondering, is it enough? Am I doing it too much? Like, am I getting rid? And you're just living in a place of panic. And I don't want to say panic because I don't personally feel panic, but I feeling, like I say, the rest of the country, I feeling the weight of that. And again, I'm trying to get accustomed to this new ritual, what my life is like now. And as every day progresses, I am thinking about all of the possible outcomes of this. And, you know, I just read a post about someone who said she was feeling ill since February last month. And she went through a series of tests, and they only now testing her in March to see if she had COVID-19, as much as she had all of these symptoms. And this is somebody who was out in the community because she said she went to work, she went out, she thought she was just sick, with the flu, and they only now suspecting that it is COVID-19. And all this time has passed, would have come into contact with all kinds of people. And I mean, this is what we have to now consider because we're hearing about the imported cases. A lot of talk about imported cases, but what about right here who have not been tested as they have? What will, country the illness and pass it on to others?
I want to let Tony weigh in on what you on everything and what you just said too, because I want to say something to that, and I want to make a point, and I want you to remind me. I want you to remind me about the analogy of the red trucks. If I forget, because the analogy of the red trucks is important. Tony.
Well, again, good evening, Felicia and Philip, Trinidad and Tobago. I like the analogy what you were talking about earlier, pertaining towards the atomic clock. Um, is it being blown up more than what it's supposed to be? It seems that way when you look at the information, at how you have the numbers coming in, comparing to a lot of other things around the world, different times in our history. You would realize that the death toll and the situation at hand in itself has been, for some reason, blown out of proportion as sorts. I think media has a large part to play with it around the world, not just here in Trinidad, as well as governments as well, specifically our own, because I mean, you all know that we've been talking about segregating, and well, not segregating, but quarantining or having a level of control over this. Even at the beginning of the year, we made a call on canceling Carnival, or pushing it back on a later date in the year, for us to see what is going on with this on a global scale, especially here in
Let's say
Trinidad.
something
But
here.
again, the government didn't do such a thing.
Tony, let me give you a number. Coronavirus deaths right now, from start to now, is 18,892 people. Start to now. In that time, 111,000 people have died from the flu.
Hmm.
Hmm.
And I know that
That
they're working to
that
say, don't. Mhm.
No, but that you're given the numbers there, and at the end of the day, really and truly, are we blowing this beyond where it's really supposed to be? Now, again, remember this is something that is affecting us on a global scale. It's not just here locally. So, what is the ramifications Trinidad and Tobago is actually going to be dealing with in the months to come? Because we depend so heavily on imports, and just about the fabric of our lives is dependent on imports, and having
Tony,
the entire world economy slow down, I mean, brother, we're gonna be in a very bad place very very.
learning the delay, right? Learning to manage the delays. Felicia, coming back to the analogy of the red trucks, but I want to say something. 1,238 people died from the flu today. 18,000 people, just under 19,000 people, have died from coronavirus in the last 6 months. Now, this is the analogy of the red truck. This is my analogy that I am putting in the public space, right? If I asked you how many trucks there were in Trinidad, you could tell me. But if I told you, count only the red trucks, the number.
The question for me, and it plays back to that whole hoax thing. Is this being, and I don't want to sound like a conspiracy theorist, but is this being deliberately mismanaged? Because it's hard to believe that they would not think to test the 20,000 people that came back into Trinidad, or not even test, but put them in a quarantine at least. So, I mean, you can't be that incompetent in your thinking.
And that's my point. If the government thought that coronavirus is as bad as it is, why they didn't quarantine these people? How many people it is in Barbados? 35 people?
Yeah.
I
You're
don't
not
have those
bringing in,
numbers on me.
but we could bring those people from Barbados to Trinidad, command their Bel Air Hotel in Piarco, turn it into a quarantine all, isolate the 35 of them. You see, people talk about all the cruise people were together. They were on a cruise together. They were isolated by the nature of what they were on. So when you brought them to Trinidad, you were supposed to quarantine all of them and wait at least the incubation period to test all of them. The 20,000 people, they are actual people in Trinidad and Tobago. When I ask and we ask, how do you allow 20,000 people into the country without quarantining them, without testing them? People are asking, where do you put 20,000 people to quarantine? It's a good question. A better question is, if 1,000 of them is carrying COVID-19 coronavirus, what did we just do to our society? What did we just do?
No,
Very
that's an
very true.
extremely a good question.
The
It
numbers
is.
and the numbers not adding up. Yeah, go, Tony, go.
No, no, no. You're absolutely right. I mean, we have just literally allowed this thing to be anywhere and everywhere throughout the country where we don't even have a clue. As far as I understand, I think it's 300 and some people on the island that they've been tested for the disease. We have 1.4 million people. I mean, what's up with that, Matt? Is it that we don't have the resources that we need in order to really test the entire population or as many people that we see highest at risk to put the rest of the population at risk in itself? What are the true reasons? You hear the Minister of Health coming on national TV talking all kinds of talk, but where are the actual results, and how are we truly trying to protect the country? I mean, listen, this entire situation right now is really really not a good one, and not only I am in fear where the disease in itself, the virus in itself is concerned, but my even greater fear is later on in the next few weeks or months what our economic standpoint is going to be in Trinidad and
And
Tobago,
that
having to deal
is the
with
point.
not only the virus, but I mean really.
That's the point. We have to confront this. We have to confront this. A lot of people talking from the position of, and I keep saying this, don't let the people with full bellies make the decisions for the people who hungry.
Yep.
Very
We
true.
have Lyndon Mack from Tobago on standby, master control. I don't know if you could bring Lyndon Mack into the conversation. I don't know if yeah, Lyndon, good evening, welcome.
Hi, good evening to everyone. Hope you're hearing me clearly.
Hearing you clearly.
Yes, I'm hearing
Are you
it.
in a
Super cool.
How's it in Tobago, Lyndon? We had to work with this delay, so we're gonna work with the delay a little bit. How is it in
Well,
Tobago,
Tobago,
Lyndon?
it's very dead. Especially after a lot of bars and restaurants have been closed down. Currently, right now, a lot of the business community have been in a bit of panic, especially seeing that their income have been practically closed off. Them not having the adequate time to prepare. We're seeing a lot of the business community having a numerous amount of conversation, and that includes the CCPA, which is one of the organizations I sit on, the hotel authority, well, the tourism hotel authority, Tobago Hotel and Tourism Authority, and they had a couple of meetings with the government in Tobago. So yeah.
Is Tobago going to survive this economically?
Sorry, repeat that, please.
Is Tobago going to survive this economically?
Somehow I just heard you said is Tobago something.
Is it going to survive economically? I think our connection is a poor connection, Master Control. Master Control, I don't know if you hear me at all, Lyndon? Master Control, you have to take
Yeah,
Lyndon out and
hearing some of the things
let
you're
him.
saying. I think the only thing I heard you said was is Tobago. The next 4 months, um, they are looking at inter-island shutdown totally, but that I don't see that possibly working because currently they are saying that we have grocery stores that have grocery for 3 months, but that's basically really not true. Um, we have persons are panic buying in bulk, and shutting down the entire island is you're literally putting the panic in a frenzy or the public into a frenzy because you don't have food on the island, and Tobago has not been self-sufficient for donkey years, so doing that is going to cause a lot of problems on the island.
But and I want to bring Felicia and Tony into the conversation. What is going on where the actual treatment of coronavirus patients in Tobago is concerned? Are all coronavirus patients from Tobago going to have to be sent to Trinidad?
Wow, I don't think I got that question at all. You want to repeat that for me?
Satish, I don't know if this is gonna make sense. I don't know if you could try to have Lyndon reboot himself, or I don't know what's going on with this connection, but he's not hearing. Felicia, you want to try and see if Lyndon.
Linda, you can hear me?
Felicia, I can hear you clearly.
You can hear me? Philip was asking
Clearly.
what is happening with the persons who would have tested positive for COVID in Tobago if treated Tobago, or are they being sent to Trinidad?
Well, currently, from what we are hearing, we had one confirmed case. That person was quarantined at a section in the TRHA. I was told that preparations was being made for that person to transfer to Trinidad. I did not take the time to follow up on those updates. My calls, my to be honest with you, my phone has been literally been bombarded by calls this week, um, just because of this situation. Because what is happening is we have had basically a serious lack of leadership in dealing with this thing head on. Most what you're hearing is at press conferences from Trinidad, and then you're hearing the press conference coming from Tobago. I think we are supposed to be having our next media briefing tomorrow with the that should be from the chief secretary's office, because they're doing some meetings with the business community. However, today there some reports um, which I've directly stated personally that for the information that came out of today's media briefing, I'm totally not satisfied with the statistics and the data to support what has been reported by the tourism agency in Tobago.
I want to know, and I hope if he doesn't hear me, Felicia, I hope you can repeat this question to him. Why wasn't Tobago closed off on the 16th of March to human traffic? Why wasn't it isolated for human traffic so that we could have quarantined the 56,000 people in Tobago and protect them from COVID-19? Lyndon, you heard that?
Felicia, you might have to repeat that question for me because I don't think I'm hearing Philip
Ah,
clearly.
but you hearing me okay still, right?
Yeah, I'm hearing you okay, clear and clear.
He was asking why was Tobago isolated from human traffic into
Not
from
isolated.
why was Tobago not isolated? When we discovered that we had a case here in Trinidad, why wasn't Tobago isolated from traffic coming to and from Trinidad to prevent you guys from contracting own cases?
Um, we have a THA Act, but a lot of persons are unaware of how that act is being used. You're talking about shutting the borders down, but the question would be who makes the decision to close the borders? Is that an immigration issue, or is that
It's
the
a public
authority
health
of
issue.
Trinidad and Tobago?
It's a public health
Sorry,
issue.
basically
It's a
that's the
public
problem
health
we're
issue.
having right now in terms of. Sorry, Philip, repeat that for me.
I'm saying it's a public health issue. It should override and guide. We've known that this was if we say that this is a catastrophe, a crisis of epic proportions, why not close Tobago? Tobago had 0 cases. Why did we have to make the same mistake twice?
But then again, I will say to you, it's a lack of leadership. I will also say directly, just before this coronavirus situation occurred, we had a change in the division of health. So Agatha Carrington, who would have um, left office, we just had the Councillor Tracy Davidson Celestine being sworn in. I think if I'm not mistaken, would have been something between last week or week before last week. So I saw that position vacant at the time, And basically, it's safe to say we had no one who would have been overseeing Tobago's situation.
Philip, I have a question further to your question though. You asked why wasn't Tobago isolated? My question stems from what Linda would have said earlier, where the victim was isolated in a ward of the Tobago Hospital. My question is, the government said over a month ago, back in January, when this issue was raised, first in the media and then first on social media by people who were living was how they were prepared are we for COVID-19. I remember the government being very confident of themselves, overconfident if you ask me, saying that, we had this in place and that in place. Yes, we're now here in the middle of the crisis, and there still seems to have been no proper plan for Tobago, because if you were looking at what a situation with COVID would what it would entail, you would obviously be thinking about the two islands and how you're going to separate and isolate one island in the event that the other island gets it. And a real plan would have been thinking of these things. A real comprehensive plan wouldn't just be looking at hospitals in Trinidad, but they would be looking at hospitals and areas where we can isolate and quarantine people in Tobago as well. A lot of what is happening now in Tobago seems very last minute, seems very haphazard, like thrown together. And I have to ask, where was this almighty plan that we kept hearing about?
It's reactive.
Alicia,
It's all reactive.
I want to say to you, I really want to say to you, I commenter, because Trinidad and Tobago has had a problem for the longest while where proactive planning comes into play. What you're seeing currently right now by the government is not proactive planning. These are reactive measures due to poor planning. And I mean, if people would really look and see what has happened from since December, when this thing became an epidemic, we had a minister coming to the nation on the 26th to say we are not cancelling Carnival. Now, the effects of that for me personally, and I will just say personal and my bias, the only persons to stand immediate loss to this Carnival fiasco would have been the band leaders, the hotels, promoters, and persons who would have gone to banks to take loans had we taken the time to put some real hard mechanisms into place. Banks could have been able to revoke loans to persons, and persons could have been in a position to prepare for months down the road. But because of that, now we have a major problem where...
No, you go ahead.
Yeah, I was just saying, because of that, now we have a whole nation now in a problem because, one, we're broke as a government. We don't have money. You have the Minister of Finance mamagaing the public to tell the public we're going to do this and that. And my question still remains unanswered. Where are we getting the money to facilitate these grants and all of these other plans that you're putting into place? In Tobago right now, I can safely say that after 58 years, we have zero reserves. And this is the question I had with someone today. Can Tobago take the deposit to go in this so-called heritage stabilization fund or the contingency fund that they say they have? How much does Tobago have?
Tony, see if Lyndon is hearing you as well, because the government is proposing to spend money on hotels. Do not see the irony that Tobago cannot take care of itself medically, can't even quarantine one COVID-19 patient. You can't give them the facilities to ventilate and care for one patient. But in the time of this crisis, you're using the crisis to fix hotels instead of hospitals.
But who's traveling now, though? Who's traveling on the global market right now? Who's staying at hotels?
Yeah, but Linda, you had mentioned, you said something really important there before, where the government basically showing with practice them being reactive versus them being proactive. And we continuously preach this. We are able to forecast certain situations and basically cater for different scenarios. Why are we not, where our leaders are concerned, creating an environment of proactivity versus reactivity? You understand? I mean, it makes no sense. And right now, Tobago is not in a good position. In fact, they are holding the even shittier end of the stick because, like Lyndon said, Tobago is a place that is basically dependent on Trinidad and Tobago. In fact, on Trinidad, I should say. And I mean, where that void was in the medical sector in Tobago, where there was deficiencies in really sorting out what was happening where the virus was concerned with the effects for Tobagonians. Again, that is another sign of gross incompetence by this administration. I mean, it's absolutely ridiculous, and we are seeing ourselves running directly into a wall. And the question is there's no brakes and no way and no how for us to stop this. I mean, we can't continue going down the road that we are going and insisting that everything is okay. We cannot. We just simply cannot. This will end in sight because we are the ones that's going to feel the brunt of everything, not just where the virus is concerned, but economically. And this is something that's going to carry us very, very far into the future where the people are going to be hurt for a very long time. It is going to take us a very long time to dig ourselves out of this hole if we continue going down the road that we're going down, being reactive and not proactive.
And that's
We're not going wrong,
my point. That is exactly one of my issues today. Because when I saw we have what we call the Tobago Tourism Agency doing a press conference, and they are indicating that we have a loss of 8 million. Now, I personally don't know if I'm living in a twilight zone, but for anybody to say that you're losing 34 million between January to March is, for me, it's typically highly irresponsible. Carnival happened like normal between January and February. If there were losses, it would not have been due to COVID-19 because in travel industry, people cancel flights all the time. We know between Trinidad and Tobago, there would have been problems with our A&C bridge between CAL. People can't get flights. Those are smaller, minor problems. And then persons taking other factors into consideration to say, hey, I have to cancel my travel. That will not directly account to business between January and March to $34 million. And I don't know directly what data they are guided by. If my memory serves me correct, we have approximately 194 hotels. I have not even done the research for bread and breakfasts and guest houses and villas. So I don't know what they are guided by in terms of that loss. And then we have the other 54 million that they are saying that we are expected to lose. These
but
figures don't add up.
Lyndon,
And then on top of that, go ahead.
But Lyndon, hear me out there. You're calling those numbers, and those numbers are very much real from the research that you have done. Yes, but the question is what is the economical cost we are going to be facing at this juncture for the future, for the next few months? I mean, again, if we were proactive and consider and quantifying the losses that we would have incurred, having to put it upon ourselves versus having to wait and react due to a global crisis taking place where Trinidad has no other choice than to be affected and deal with it without any level of control. I mean, really and truly, we are looking at a direction where we can't even quantify at this point the level of losses that we are going to be gaining within the next few weeks to months coming up within the future. Whereas, had we been proactive and possibly freeze the economy, push Carnival back, whether it be for 3-4 months, let's see what the global environment is, what the environment is here locally in Trinidad for our own citizens. Something that is a lot more controlled, not just within the health sector, but economically as well. Because if we know exactly what the hit that we're going to take up front and systematically put it in place, then now we would have known exactly what it is we were working with, and at the same time buy ourselves time to try to create an environment in Trinidad
Tony,
and Tobago where we can be somewhat self-sufficient, such as agriculture, putting investment in agriculture, feeding the nation, especially in an environment like this where we can be food independent, because that will be the next oil. That is the next gold mine that we need to look as a precious resource,
Tony, I want to jump
food
in
and
here.
water.
Tony, I want to jump in here. How we can close borders now? How all of a sudden we
Correct,
know how to close borders? How all of a sudden
correct.
we know
Exactly.
to operate the country? They've been giving us nonsense to hold for years. All of a sudden
That's
we know
right.
the answers to questions. All of a sudden the banks know their responsibility to depositors and the citizens. All of a sudden we know that our public health system is a catastrophe. All of a sudden,
It would be interesting for
So
me
currently, what
though,
you
because I mean, we're talking about losses now that we're experiencing, and it would be interesting to see what the losses would have chalked up to, or how they would come here to tackle if we had done proactive and responsible thing, which was to